All right, away from that, and let us cross over to Nakuru, where the county government of Nakuru is today rolling out Lenacapavir injection, a new drug that helps prevent HIV infection. The medication is administered twice a year to HIV-negative persons who are at high risk of infection or exposed, and is seen as a great milestone towards reducing the spread of HIV. We now want to join our very own Ken Gashohe in Nakuru. Ken, good afternoon. Some good news there to the residents of Nakuru. Perhaps if you can tell us more on that particular rollout.
Thank you very much, Grace. Indeed, we are here at the Nakuru County Hospital, where the rollout of Lenacapavir, a new drug that is meant to help prevent HIV infections among the people. And this is a drug that has come as a great milestone in ensuring that we reduce the high number of infection cases that have been reported over the years. And this is not about Kenya. It's a drug that has been embraced globally, because this is a scourge that has affected populations across the world. And with me here is one of the county health officers who can maybe tell us more about this drug, starting with your name.
Thank you. My name is Martha Kahora. I work in Nakuru County, the Department of Health, in the HIV program. And today we are really excited to be launching the new injectable long-acting pre-exposure prophylaxis. We are really happy to have the drug. Previously, we have been using the oral prep. Those are the tablets that are taken daily. And it has been a challenge for some of our clients, because sometimes they forget to take the medication, and therefore adherence has become a problem. So for such clients, we are really excited to have this new innovation, new commodity that has come in on board. We have two, that is cabotegravir and lenacapavir. So for cabotegravir is an injectable drug that is injected every 2 months, and lenacapavir is injected every 6 months. So in terms of adherence to medications, I think this will come to address that gap which has been there. So when we look at our statistics, in the last year, 2025, we started new clients on the oral prep, over 20,000. So in terms of HIV burden, Nakuru also has a burden, because currently we are having over 46,000 people who are living with HIV and have initiated the medication. And that also tells us that if we are not able to prevent, then we will have more new infections. So having this new commodity on board, in addition to what we have been having, we are really excited. But this does not say that we will throw away all the other prevention methods. We will still use those methods. The condom use, abstinence, being faithful, and those who are on ARVs, ensuring they take their medication, they are virally suppressed, and therefore reducing the risk of transmitting to other people. So we are going to use this as a combination towards fighting HIV, so that we can reach epidemic control. So in our county, we are among the first counties that are in the first phase of the law of the giving the new commodities. And we have 10 facilities in our county that are in the initial phase. And so we have Naivasha Sub-County Hospital, Gilgil Sub-County Hospital, we have Gilgil Center of Hope, Bahati Sub-County Hospital, Nakuru Referral and Teaching Hospital, Langalanga Sub-County Hospital, Hope Worldwide Dice, Rongai Health Center, Njoro Sub-County Hospital, and Molo Sub-County Hospital. So in the initial phase, these are the facilities that have the drugs. Today we are launching that in Nakuru County, but the national launch was done at the national level on 26th of Feb. And so when our population heard about the launch, some of them came to inquire from the facilities. So even before the launch in Nakuru County, those who came, we did not send them away that because we've not launched. We have also been able to give them the commodities.
Maybe what does this drug mean for discordant couples, and maybe who is eligible to get this vaccine, this drug? Are those people who are already infected eligible to get this drug?
Those who are eligible are those who are HIV negative but are at a risk of getting HIV. So anybody who is at risk of getting HIV is eligible for this commodity. Before we give the PrEP, we first test to ensure that you're HIV negative before we give the drug, and then we continue monitoring depending on the drug that you are on. for the discordant couple that is in a relationship where one partner is HIV positive, the other one is negative, we have also been having challenges because sometimes they want to conceive and we are telling them not to. If we are telling them not to use a condom, then the PrEP will come in handy, including the injectable PrEP, because it will protect the negative partner and they are able to live well in their married relationship. So we have the populations that are going to benefit. We have the key and vulnerable populations within Nakuru, that is the sex workers. We also have the adolescent and young people who are at risk. We have the pregnant mothers who could be at risk. This is a really crucial population because if they are at risk, they are also at risk of infecting the baby. So if they are at risk of getting HIV, we also give them the PrEP so that they do not get HIV and therefore our baby will be safe.
Thank you very much indeed. This is a great milestone, especially for anyone who is at risk of getting the HIV infection. And this is a drug that is coming in at a time when many Kenyans are used to maybe the oral drug, the oral tablets that are taken daily. But this one now is going to be an injection that lasts for 6 months. That means twice a year. Back to you in studio, Grace.
Right. Thank you so much, Ken. And that's a very positive story coming